Hi, I'm Dr. Jyoti Patel, and today we're talking about the neurobiology of dependency, tolerance, and addiction. To understand this better, let's talk about how the brain perceives pain and pleasure. So pain. Imagine you stubbed your toe. The pain signals from your toe make it to your brain, and then your brain releases a chemical, a substance called opioids. Those opioids attach themselves to receptors to downregulate pain, so your pain goes away. Let's say you were in a car accident and you suffered multiple injuries and you're in severe pain, and you decide to take a pill, a prescription opioid. That opioid also attaches itself to the same receptors to downregulate your pain. Maybe for a day or two you feel better and you can stop taking it. But let's say you decide to take it every day and every week and every month and every year. Then you cause physical changes to the brain we call neuroplasticity. It causes the brain to now become dependent on the opioid. Taking the opioid makes the pain go away. Not taking the opioid causes the pain to escalate. And so the person experiences physical and emotional pain from not taking the opioid. Not only that, but if they go through withdrawal, it causes a severe flu-like illness, 10 times the flu. Fever, sweating, rigors, jitteriness, anxiety, feelings of doom, nausea, vomiting, diarrhea, physical pain. So the person is pushed to continue to take the opioid to keep those symptoms at bay. That's dependency. Not only that, but the brain upregulates those mu receptors, so you require more and more of that substance or higher and higher dosages of that opioid to keep your brain from experiencing pain. Most people can relate to alcohol in that way. You might need one drink to make you feel calm, but then you find yourself drinking two, and before you know it, you're having a bottle of wine every night, and maybe now you're drinking hard liquor and you're mixing with other substances to get the same effect. That is what we call tolerance. So folks that have started taking pain medications for benign reasons, such as an accident, might find themselves becoming dependent on the drug and developing a tolerance requiring higher and higher dosages of it. And not taking the substances puts them into a severe state of withdrawal, which keeps them taking the medication. The problem with these substances, whether it's opioids, alcohol, sedatives, sleeping pills, is not only do they help mitigate the pain or the symptoms that they're trying to fix, but it also shuts down the breathing centers of the brain. So when you start taking more and more of these substances, you're at higher risk for shutting down your natural breath response from the brain. So your breathing stops, and you actually end up overdosing or dying from it. And that's not an uncommon thing these days, unfortunately. Second is the pleasure center of the brain. In another part of the brain, we produce something called dopamine. You might know this when you win first prize, or you get an A on your test, or your favorite football team wins, or your boss gives you a promotion. Anything that causes pleasure causes us to release dopamine. Now, there are some people genetically that are prone to becoming addicted to the release of dopamine. They may be dopamine deficient to begin with, and that heightened sense of pleasure causes them to crave substances or activities that release dopamine in their brain. Now, these substances can be not just opioids, but can be alcohol, can be sex, can be gambling, can be gaming, can be food, can be activities such as exercise or work. Anything that gives people a high causes a release of dopamine, which can then cause them to become addicted to that substance, and they become compulsive in terms of acquiring that. So they can't function during the day without thinking about their next fix, where they're going to get it, how they're going to get it, what are the means that they need to acquire to get it, and they will do anything to acquire that substance and stop at nothing. And unfortunately, that can lead down a vicious cycle of problems with the law, problems with their family, problems with their finances. But because the addiction can be so powerful, and this desire and craving for dopamine can be so deep, that they are willing to sacrifice their life to acquire the substance. So that's the neurobiology of tolerance, dependency, and addiction. One has to do with mitigating the pain, decreasing their pain sensations, keeping up with the substance so that they don't go through withdrawal, and also requiring more of it to keep the same effects. And the other is by releasing dopamine, they have a certain sense of pleasure, which causes them to crave that, which causes them compulsive behaviors to seek it. Now, in the upcoming videos, we'll talk a little bit about how you can partner with your healthcare provider, addiction specialist, your community, and other service providers to help people that are dealing with addiction, tolerance, and dependency overcome this medical problem. There's so much cultural stigma to this problem. We feel like there's a moral or ethical reason why these people have succumb to drugs or succumb to alcohol. In fact, it's neuroplasticity. It's changing the brain chemically that's requiring these patients to continue this behavior. And until we come up with a comprehensive plan to help them off this merry-go-round, we're only going to see this problem escalate. So in the upcoming videos, I'll talk about different ways that we can help as a society people that are dealing with this serious drug problem or addiction of any kind overcome it. I'm Dr. Jyoti Patel. Follow me on Facebook, Instagram, and Twitter. Till next time.